Hello friends, welcome to my channel Clinical Biochemistry by Dr. P.K. Prabhakar. Today I am going to talk about one of the very new course which is going to run at some of the institutes in different names. Somewhere it will be in the PG diploma, somewhere it will be in the reproductive biology, somewhere it will be in the name of M.sc Clinical Embryology. So we are going to see those courses. So first we will see what is clinical embryology. When we are talking about the clinical embryology, so it is a clinical field, and embryology means we are talking about the fertilizations, embryo, egg, zygote formation, and all those things. So this clinical embryology, that is a stream of biology which mainly focuses on the study of fertilization of the egg and the healthy development of the embryo in the form of fetus. So I have already told you it is, we are talking about the egg, fertilizations, ovum means sperms, and then development of the embryo. So there are some of the specialized doctors, like when we are talking about this field, so some specialized doctors which is working in the field of clinical embryology, and they are known as embryologists. So an embryologist normally focuses on the creation of embryo outside the means in the artificial environment into the labs. So they create the embryo outside the mother's womb, and with the help of sperm and eggs, means the fertilization process occurs outside into the laboratory conditions. Therefore they play a very critical role into the lives of the couple who does not have baby, does not have baby because of the natural conceiving abilities, or they are having some kind of drawback, some kind of defects. Because of that one, they are not going to conceive any kind of fetus. So in that case they help them. So in country in India, like many countries we are having, so roughly there are number of populations are there, a large number of population, they are facing number of issues of infertility. So in that case, in those infertile couples, normally these embryologists are considered as a lifesaver for their family and the couples. So eminent medical institutions or organizations have been offering different courses. I have already told you, some places it will be in the name of clinical embryology, some places it will be in the name of postgraduate diploma in clinical embryology, some it will be in the different names. Okay. So like if you see here, roughly we are having three specific courses we can see. They are either in the with the name of master in clinical embryology, that is M.sc post graduation degree. This course is of roughly of 2-year duration. So admission criteria is normally, because it is a postgraduate course, so normally you require a undergraduate degree in this field. The minimum fee for this course is roughly 1.25 lakhs, and it can go up to 5 lakh per semester. This is the per semester. And after the completion of the course, roughly minimum and maximum salary can be in the range of 15 to 25 lakhs. And after this course, you can join different organizations, different IVF labs in the senior clinical embryologist or research analyst. Then second course, normally there are some organizations they are having with the name of postgraduate diploma in clinical embryology. This is also of 2-year duration, and there normally university examinations, they 10 plus 2 or 50% marks in that case. This course is slightly not as equivalent to the as M.sc. This is just a postgraduate diploma course. So their fee roughly ranges from 50,000 to 1.2 lakh per semester, and salary also going to vary in this case. Roughly it will be 5 lakh per annum to no means upper limit cannot be any limit. So and they are normally going to join in the different labs as a assistant clinical embryologist. Then we are having a certified course, that is fellowship programs in clinical embryology. This will be from few months to 1 year, and for this course normal eligibility criteria is 10 plus 2 examination with the 50% aggregate marks, and fee is roughly 30,000 to 1 lakh per semester, and means income will be, or salary package will be lower than the postgraduate or diploma courses. They are also going to join in the labs with the means on the post of assistant clinical embryologist, and after their fine. So what is the scope of this course? Means when we are talking about the clinical embryology course in the India or in abroad, so aspirants studying, or those students who is going to study this clinical embryology or practicing it with any course, either it will be PG diploma or it will be MSc. So they normally going to provide a prominent jobs in both government sector as well as in the private sectors. Apart from the government hospitals, like the approximate salary normally going to vary. So if you say the approximately salary varies from one organization to the other organizations, and the salary package mainly depends on the factor like job profile, experience of the candidate, and expertise. Private or corporate sectors have been also offering a better salary ranges to the embryologists. Relevant factors like expertise, learning experiences, and years of practice are often considered for the corporate sector. There, apart from the government and private sector, certain self-established or self-running reproductive or embryologist centers also have been founded. Later on, I will show you some of the places which are one of the leading recruiters in this field. These medical centers mainly focuses on the study, research, practices, diagnosis, and treatment of the patient with health issue related to the female reproductive system, sexual well-being, and infertility. These centers offer being better salary ranges as compared to the government or the private sectors. Therefore, their success rate is better compared to the government and the private sectors. Infertility clinics have been resolving the issue of patients with a better success rate, since they are mainly dedicated towards the study and practice in clinical embryology and reproductive studies. Now, if you'll see here, this course, what are the course content? So it is not exactly the replicative of the courses and other things, because later on I am going to talk about the course which is running at Lovely Preparation University, that is MSc in Clinical Embryology. So I will tell you the details, the admission process, the fee structure, the scholarship, what they are offering, and other details also. So this is some of the important courses which in this course normally students are going to study. So not like they are going to study basic concept of cell biology, molecular biology, embryonic stem cells, embryology of the reproductive systems for both male and female, physiology of the male and female reproductive systems, spermatogenesis, oogenesis, gametogenesis, fertilization and implantations, then embryo development from the first cleavage to the up to implantation, biochemistry including steroid metabolism, hormones, all the steroid hormones, sexual hormones, and how they works. Then genetics, because of the genetic disorders, ovarian hyperstimulations, patient screening, and types and choice of treatments. So roughly these are the course content. This will be divided into different subjects. Later on we will see. So this course is going to run at different locations, different organizations. Like one of the leading institution in India in terms of medical education is AIIMS, that is All India Institute of Medical Sciences. They run this course with the name of MSc Reproductive Biology and Clinical Embryology, and this course is roughly cost 2,705 rupees. Then other second organizations we are having, that is Bangalore University. They don't have a postgraduate degree, or they are having PG diploma in clinical embryology and ART, assisted reproductive technology, and fee structure is not well established, means declared. Then third we are having Madras University. They are having PG diploma in clinical embryology. Their fee is roughly 5,000. These fee are roughly per semester. Then we are having private one of the first, or you can call it first institute which is having clinical embryology, along with some of the corporate like Cooper Surgical. They have just done a kind of MOU with the Cooper Surgical for their lab training and other things. So Lovely Professional University is having MSc Clinical Embryology, and their fee is roughly 1,85,000 per semester. Amity University, they are having not PG diploma, they don't have, they are having only diploma in clinical embryology, and they are having roughly fee of 4,550,000 rupees. Then Manipal Academy of Higher Education, they are having MSc in clinical embryology, but not with any organizations, any institutions, any corporate, any IVF labs. But the cost, if you see, this is way too highly costly. That is roughly 12,62,000 for total course fee. So in not only in India, outside India also we are having this MSc Clinical Embryology. Like this, if you see, this is the University of Oxford. There we are having MSc in Clinical Embryology, but this course is of only 1 year courses, not 2 year course as we are having in India. Normally all the postgraduate degrees are of 2 year. So this international degree, but it is of only 1 year. Then second university which is also going to offer similar type of course, that is University of Dundee. They are having human clinical embryology and assisted conception, that is post graduation degree, but again this is of only 1 year duration, not of 2 year duration. So in India we are having only 2 organizations, you will see, one is Manipal and second one is Lovely, which is going to offer you MSc in Clinical Embryology. In terms of fee, if you will see, Lovely Professional is slightly cheaper than the Manipal Institute of Medical Sciences or Health Sciences. When we are talking about the job profiles for this after this course, once you are going to complete your degree, you certainly require a job. So when we will see the job profile, due to the growing medical concerns of the infertility, as it is going to increase because of the pollutions, because of the job profile, because of the lifestyle changes, normally the rate of infertility is going to increase. So as growing medical concern of infertility is increasing in the large sector of the Indian populations, the industry requires eminent and well practiced embryologists and infertility clinics, because infertility increase. So in that concern, in that ratio, we also requires the embryologist. Currently in India we don't have too much of labs, are more than 30,000 labs we are having for IVF labs, but in that ratio we are having very less embryologists. So therefore there are always plenty of job opportunity for the graduates with a good scope of clinical embryology. So if you have done a good study, you are having a good expertise, you are having a good hands of IVF technologies, certainly you will get a better opportunity or better job profile. When we are talking, their professions is highly respected and extremely lucrative. So normally 2 major job profile, if you will see it, that is, one is as a senior clinical embryologist and second one is assistant clinical embryologist. In this case, job profile of senior clinical embryologist is that is a senior clinical embryologist offers the best treatment process as per the complications of the different patients, whereas assistant clinical embryologist normally they deals with the testing and the initial analysis of the patients. So as name suggests, this is the senior. Normally major treatments will be done by the senior clinical embryologist and they just assist them. Then if you see the top recruiters in India, there are a number of healthcare institutions seek out candidates with the degree of clinical embryology. Means if you are doing 1 year course, if you are doing postgraduate diploma, or if you are doing 2 year course, so as much as expertise you will have, as much as experience you will have, certainly you will have a better job opportunity. So several job profiles are available from health units, organizations and hospitals. Listed, there are some of the important IVF centers I have listed here, that is Cooper Surgical, Indira IVF, Select IVF India, Dynamic Fertility Centers, Max Healthcare, Hiram Nandani Hospitals, Apollo Hospitals, Cloud9 Hospitals. These are some of the centers which is dealing with the IVF technology, and there normally we require clinical embryologists, and they normally offering a better package also. If you see the salary package, normally for senior clinical embryologist, roughly more than 15 lakh per annum, and if you see assistant clinical embryologist, roughly it will be around 4 lakh plus per annum. The salary figures normally which is mentioned here, means I just now I have mentioned is that is just for your reference purpose. It is not the actual amount, actual things. Now come to the course which is offered by the Lovely Professional University in terms of clinical embryology. This course is of 4 semester duration, so that it will be of 2 year. In this case, the minimum eligibility criteria for this qualify is the you have to qualify the exam. So if you are passed with the 60% aggregate marks in the bachelor degree in any biological fields like applied medical sciences or biosciences or medical science or allied medical or life sciences or equivalent, along with that one you need to qualify one of the tests which is Lovely LPU is conducting, that is called as LPU Nest. Later on I will tell you this LPU Nest is also going to offer you some added advantages. In this case, the 5% relaxation is going to be given to the in this 60% marks. So 55% requirement is for northeast states, Sikkim candidates, and the some of the childs or the dependents of the defense personals, wards of Kashmiri migrants. For them, this is not 60%. This will be 55%. So the admission criteria for this one is merit in the LPU nest. You have to qualify LPU nest, and you need 60% marks in these subjects in your bachelor degree, or if you are belonging to any of these category, then you require 55%. So that is the eligibility criteria. Once you are going to eligible, you are going to take admissions. So you will have, I have told you, it is a 2-year program, so total you will have 4 semester. This is your first semester courses. So roughly in the first semester you are going to study anatomy, biochemistry, their practicals, fundamental of research, so because you need research also, microbiology, their practical, and animal physiology, means human physiology you can call it. In the second semester you will have biotechnics, their practicals, means all the techniques, it will be centrifugation, chromatography, means normally all the analytical techniques. Then histology of male and female reproductive systems, their practicals, infertility and ovulation inductive methods, their laboratory, research methods and design, and system embryology. This is your first 2 semester. In the third semester we are having ART techniques, their practicals, good laboratory practice in recent advances, intracytoplasmic sperm injection laboratory, pharmacology, soft skills, and systemic embryology. In the last term will be internship in the lovely professional university, because they have a collaborative, they have a MOU, they have signed with the Cooper Surgical Center. So this internship or the training will be done along with the Cooper Surgical. Once we are going to see the course fee, so this course is roughly cost 1,90,000 per semester, but this is the normal course without any scholarship. There are different way by which you can get avail the scholarship at lovely professional university. So either you have more than 90% marks in your graduation, or in more than 95% marks in your 12th, directly you will get 76,000 rupees or 40% scholarship in your tuition fee, and this will be applicable for all your 4th semester. So in that case your fee will be reduced to 1,14,000. Not only these two, third category is also there, where whatever LPU nest you had given in for your written test for your admission, if you are qualifying that LPU nest and coming in the top category 1 cutoff marks, then also you can avail this scholarship of 76,000 rupees. If you are coming in LPU nest in the cutoff 2 category, or you will have 80 to 89% marks in your graduation, or 90 to 94.95% marks in your 12th, in that case you will get 30% scholarship in your tuition fee, that will be equal to 57,000, and your fee will be reduced to 1,33,000. Again, this is also applicable up to all the 4 semester. Third and last category here is category 3 of your LPU nest examination, or 70 to 80% marks, 79.99% marks in your graduation, or 80 to 89.99% marks in your 12th. In that case you will avail 20% scholarship, that is equal to 38,000, and it will reduce your fee to 1,52,000. Again, any of these category will be applicable for all the 4 semester, means once you will avail this scholarship, that will be applicable for all the 4 semester. Along with this one, for every semester you have to pay 4,000 rupees as examination fee, and this will be along with the semester fee normally we are paying. So there are 3 different ways by which you can avail the scholarship, you can reduce your tuition fee. First, on the basis of your qualifying examinations like graduation, or on the basis of the 12th marks, which just now you have seen it. Then on the basis of LPU nest. Then we are having different other category also. So a scholarship on the basis of qualifying examination or previous qualifying examination, just now I have told you, either on the basis of graduation or 12th marks you can get up to 40,000, 30,000 or 12,000. Similarly, you can avail on the basis of LPU nest if you are qualifying LPU nest and coming into the more than category 1 of cutoff, 40% scholarship. If you are coming in category 2, then 57,000 scholarship. If you are coming in category 3, then 38,000 scholarship. These are the some of the dates. If you are going to, because this is up to 6th March, so this is for April schedule, this is for May schedule, so up to 10th March onwards you can apply. And So this is online registration starts from the 10th March. This is a date of examination of LPU next will be 10th May onwards. Then slot booking can be, you can book your slot on which date you want to give your examination, at which center you want to give your examination. So that can be done after 25th of April. Then date of examinations 15 to 31st May. Result will be announced on 6th July, and online counseling and seat allocation will be from 6th June onwards. This is the website where you can find the detail about these courses, and from that place you can also go and apply directly. LPU has signed a MOU with the that is US based Cooper Surgical Origio centers. So this center is normally going to help them in terms of training, in terms of adjunct faculty, and many other ways, workshop and other things also. So certainly this is a good opportunity for the students to enroll there, write a test, and avail the a scholarship up to 676,000 per semester. And so this is all about what is embryology, clinical embryology, from where we can go, and what are the best institutions which is going to offer which type of courses, and some information about the courses which is running at the lovely professional university. Hope you will get you have got some of the information about this MSc clinical embryology courses, their job prospects and their placement details. If you like the video, press the like button. If you are not subscribed my channel, you can subscribe it. You can press the bell button so that you will get all the notifications on time. Thank you very much. Have a nice day.